I'm not surprised that we're at this point right now, especially if we realize that this is the 15th committee where they've talked about this at the World Health Organization, and numbers have been going down over the past year. At some point in time, there needs to be a discussion about international funding, collaboration, priorities, mandates, and whether or not this truly is an emergency. But I think it's actually very important that people remember that just because this is no longer designated as a public health emergency of international concern, that there's still not a lot of disease out there and potential deaths. Case in point, HIV, malaria, influenza, a lot of other illnesses kill thousands of people every single year. Those may not be emergencies of international concern, but they're still threats, just like COVID-19 right now is.
Yeah, really good point. How did we get to the point that we're at today? I mean, there's different camps that emerged during the pandemic. We heard so many people say herd immunity and it goes away. Others would say, hey, we need the vaccines. You got to get the shots in the arms. Is it a combination of both or one over the other?
It really is a combination, and it's hard, Mike, to believe that this was over 3 years ago when this was declared, and scientists, public health officials, epidemiologists were postulating of how we would get to this point. And it's been a rocky roller coaster, to say the least, especially as we started to see global disparity with respect to access to testing, treatments, and vaccines, and also having the virus continue to mutate. And so I think the important thing, as the WHO mentioned, is that today can mark a time for a little bit of cautious optimism and celebration as the world bound together to get here. But at the same time, we have to look back and realize that we have 7 million documented deaths. That number is likely way higher, with some projecting it somewhere of 20 million. And to actually look to see if we have learned lessons about the supply chain, about how we're going to handle the inevitable next pandemic, which is really important to start thinking about now.
Yeah, I might get to that in just a moment, but I want to ask you about advice for viewers, because you make a really good point. I mean, they may have downgraded this, but it's still out there, and the virus is still killing people. We shouldn't let our guards down, should we?
We shouldn't, and we should look at this just like any other infectious disease that has a potential threat to anyone out there, especially those who are high risk. So you want to make sure that you're still paying attention to your own symptoms, that if someone around you is sick, you're still treating it just like it's COVID-19, influenza, or anything else. And we are inevitably going to have a discussion about what seasonal vaccines may look like with COVID-19. People should know that as of right now, being up to date on your vaccines, if you're 6 or older, involves having a bivalent shot. If you're 65 or immunocompromised, that may involve having a second booster. And for the little young ones, age 6 months to 5, that includes finishing your primary series first and then getting a booster. And that is something that we're going to revisit this fall as the virus continues to mutate.
Great points. Thanks so much for your observations, your analysis. Really appreciate it.